morning. My name is Prabhakaran Dorairaj. I'm a cardiologist and currently Vice President Research and Policy at the Public Health Foundation of India. To my right is Dr. Sanjay Kinra, who is the co-principal investigator of this study. Today we presented the trial Yoga-CaRe, the Yoga-CaRe trial, which was a large randomized controlled trial conducted in India. This trial evaluated Yoga-CaRe against usual care in terms of providing cardiac rehabilitation to patients post myocardial infarction. We conducted this study in 24 centers and recruited 4,000 patients and followed them up over a period of 48 months. Dr. Sanjay Kinra will talk briefly about the intervention development and then I will present the results.
Thank you, Prabhakar. Hi, I'm Sanjay from the London School of Hygiene and Tropical Medicine. Together with my colleagues at the University College of London, we were involved in development of the intervention to make sure that the intervention was effective and safe. So we went through a very structured process over a year trying to develop this yoga-based intervention. We started off by creating a framework for a cardiac rehabilitation program. And then within that, we reviewed all the evidence around the different poses for yoga and worked with a number of experts in cardiac rehabilitation and yoga to develop the intervention. The intervention effectively has 13 sessions that are delivered over a 3-month period, the first couple at home and the rest in the hospital in group sessions that are delivered in the second and third month. I hand you back to Prabhakar for testing of the intervention.
So what were the key findings of this study? First, yoga is feasible. It can be ambitiously scaled up in terms of cardiac rehabilitation. It improved quality of life and made people return to pre-infarct activities as quickly as possible. That's the biggest takeaway. The second, the Yoga-CaRe group patients had a lower mortality, but it did not reach statistical significance, probably because of lack of power. In fact, we had powered the study for a 20% reduction and at a rate of 20% event rate. But actually what happened was the event rate was much lower. It was around 7% and we had a 10% reduction, but that's also a big thing. The third important point is wherever people adhere to the Yoga-CaRe, that is if they attended more than 10 sessions, there was a reduction in the composite endpoint, particularly death. And I think this is a very important point and it is potentially scalable, it can be extremely useful. And the fourth point that I want to make is that it's inexpensive. Compared to cardiac rehabilitation, which requires a whole lot of infrastructure, it requires a physician, it requires a nurse, it requires a whole lot of space, whole lot of equipments. Yoga-CaRe just requires a yoga instructor who can provide training to patients. It requires a small amount of space and a yoga mat. Thank you.